to the webinar Policies on Access for Managing Medicines and Health Technologies. Um, Outlook, experiences, challenges in the region of the Americas. I am Miguel Amezquita. I work as a technical official and access for medicines and regional office of PAHO, and I am very happy to be the moderator for this webinar. For our audience in Spanish, please remember that we have simultaneous interpretation, both from English and Portuguese, just by selecting the bottom that you will find in the lower part of your
Welcome to
screen.
the
There's a
webinar,
bar.
Policies on Access for Managing Medicines and Health Technology Prices, Overview, Experience, and Challenge in the Americas region. I am Miguel Amezquita, and I work as a Technical Officer on Pharmaceutical Policies and Access to Medicines at the PAHO Regional Headquarters. And I will have the pleasure to be the moderator today. For our English-speaking audience, please remember that we have simultaneous interpretation available from Spanish and Portuguese by selecting the corresponding button on the bottom bar. Bem-vindos ao webinar Política de Acesso para a Gestão de Preços de Medicamentos e Tecnologias em Saúde. Panorama, experiências e desafios na região das Américas. Eu sou Miguel Amezquita, trabalho como oficial técnico em políticas farmacêuticas e acesso a medicamentos na sede regional da OPAS e terei o prazer de ser moderador da nossa sessão de hoje. Para nossa audiência em português, por favor, lembre-se que temos interpretação simultânea disponível em espanhol e inglês. Basta selecionar o botão correspondente na barra inferior. Muito obrigado. Bueno, cambio a
Okay,
español nuevamente.
now I'm switching to Spanish
Muchas
once
gracias.
more. Many thanks
Bienvenidos nuevamente.
and welcome once more on behalf of our Innovation Access to Medicines and Technology and Health Department from PAHO, and especially from our unit from Access to Medicine and Health Technologies. We welcome you to this event developed on access policies and price management. And maybe you will say, why access policies and not price policy, which is the most common name? Well, but because precisely we want with this event, webinar, to be just one of a series of events that, let's say, will cover as an umbrella the policies that are promoting access to medications and health technologies on different topics, in this case, prices. That's why we have called it policies for access and managing medicines and health technologies and prices. Just would like to go over the our day agenda for today. First of all, I am thinking that, well, you are seeing my screen. I just want to confirm that I would appreciate. Well, first of all, we will have a welcome message from Juliana Valdini, our regional advisor for policies on access and medications and technology and health. Also, she will be speaking on behalf Alexander Lengruber, our head of the unit for access and medications and technology and health. Unfortunately, he couldn't be because he's on a personal leave. After that, we will have a presentation also given by Juliana, and the topic, especially the access of actions by PAHO can provide to the state members, especially on technical cooperation, but specifically on policies for access. And then the third, we will see let's say an overview of the public school on public health pharmaceutical policies. And Veronica Wirtz and Warren Kaplan will be talking about that outlook for access, especially turning around prices in the region of the Americas. And after that, we will hear from two country cases or experiences. The first one from Brazil, Angela Marito Cerqueira, Daniela Marito Cerqueira, Executive Secretary from the Chamber of Regulation of Medications, CEMET in Brazil, will giving us a presentation showing us how Brazil is distinguishing prices, especially around therapeutical value. And then we will hear another experience coming from Chile, by Miguel Acuña, Dr. Aranza Acuña, sorry, head of the Union Business Intelligence will assess the impact of prices. And with this, we want to access the policies and access and prices from two points of view, more from the prices on entry, so to speak, and one on demand. And finally, we will have a discussion panel, and we will be picking up questions along the way that our audience will be making opposing to the different panelists. I invite the panelists to turn on their cameras so that we can greet the audience. I reiterate the appreciation on our department of this department organization so that we were able to develop this event. It is a topic that we have seen is being quite useful across the Americas, and we know that there are topics that um, these topics are being treated globally, not only here. And from the beginning of this year, we have been working on this webinar now. Time has come to materialize that. We are very happy to see that different countries, institutions, and organizations are here present and that we have the possibility of exchanging experiences. And so many thanks for being here with us. Now I invite Liliana Vallini. She is our regional advisor on access policy medications and health technologies, who will be telling us what our parliament does and what are the opportunities for cooperation and what are the main lines of action. So, Liliana, I invite you. Um, and you can turn off your camera, Juliana. I am going to ask you to share screen and camera. Many thanks, Miguel. Good morning, everyone.
Good morning.
Um,
É um
Good
prazer
morning,
para
all.
nós estar aqui hoje nesse
It's a
webinar.
pleasure for us to be here today in this
Eu só
webinar.
queria confirmar que vocês estão vendo
I would like
a tela.
to know if you have access to my presentation. In other words, if you can see my presentation screen.
E já estamos.
Perfect. Okay, I think I'm ready.
Gusto
So,
acá
as I said,
here
it's a
on behalf
pleasure to
of
be here with
Alexandre
you.
Huber, that is the unit chief of the access of medicines and health technologies
In health
the
technologies
IMT
and
department.
IT department.
So the IMT department, I want to introduce a little bit for the ones that never had worked with us before. The IMT department is a new department of PAHO, is responsible for promoting, coordinating, and implementing the technical cooperation and access and rational use of quality medicines and health technologies here at PAHO. So we are talking about medicines, vaccines, diagnostics, blood medical equipment, blood products, and organs, of course, and transplantation. Our work is to support all the member states in addressing barriers to access, addressing the challenge across the medical products full life cycle, and strengthening regulatory capacity and supporting evidence-based decision-making. That's the reason why we are here today, because we do have some in fact, 2 units and a special program. Our unit that is access to medicines and health technologies, more than glad to welcome you all. We want, as Miguel mentioned, to strengthen the dialogue and the information sharing, the best practices and the possibilities across the region. When dealing to access, today we are going to talk about medicines and price. And we want, based on this, to create space of strengthening the technical cooperation of PAHO together with the member states. And also strengthen and enhance the dialogue with the different stakeholders, such as academia and NGOs and private sector. So on behalf of Alexandre, I welcome you all, and I think we can move forward with the next steps. Thank you. Thank you, Miguel.
Gracias, Juliana. Como lo ven, nuestro departamento fue una
Thank you,
dependencia de
Juliana. As
que
you were
comenzó
able
a
to see,
crear
our department was a dependency of
el año
PAHO
pasado, más o
that
menos hacia
was
mediados del año
created
pasado fue
last year,
creado.
or more or less in
Venía
like
manejándose con la
mid
unidad
last
de
year.
medicamentos
It
y
was
tecnologías
the
dentro del
unit for
Departamento
medications
de
and
Masistencia
technology,
y
part
Seguridad
of the
y
technical
pasa
and
a
health
poder
services department,
fortalecer
and
la
now
gestión en
is
materia de
there to
medicamentos y
strengthen
otras
the
tecnologías en
management of
salud.
medication
Ahora
and
bien,
other health
en la siguiente
technologies. Now then,
presentación,
in
Juliana
next
nos va ya
presentation,
a dar a
Juliana is
profundidad cuál
going
es
deeper and she will
esas
show us
capacidades que tiene
what
nuestro
are those
departamento y en
capacities that our
particular nuestra
department
unidad de
has, and
acceso a
especially
medicamentos y
our unit
tecnologías
to access
para poder
medicines
prestar
and
cooperación
technologies,
técnica a los
so that
Estados miembros
can,
de la
they can
Organización
provide
Panamericana de la
technical
Salud.
cooperation to the
Muchas
member
gracias y
states of
adelante,
PAHO.
Juliana, por
Many
favor.
thanks, and please go ahead, Juliana.
Gracias, Miguel.
Thank you,
I'm
Miguel.
going to switch to Spanish. Entonces,
Okay, I'm going
buenos
to
días de
switch to
ahí. Pues
Spanish.
vamos a empezar un
Good
poco
morning, Jade, and let's
recontextualizando el tema del
start by
acceso
putting
a
you in
tecnologías en
context in
salud
respect
en
to
el
the topic of
marco del
access to
derecho a la
health
salud y de la
technologies, the
salud universal,
health,
que son los
universal health
mandatos que los países han
framework
dado a la
concept,
organización, a
and
la
that is
OMS,
what different
para
countries
el
have been able to
trabajo
provide in
con
terms of
insumos para
information
la
to
salud.
PAHO in respect
Entonces,
to
primero es
consumables and access
reconocer
to health. First of all, I
que el
think we need to
acceso a las
recognize that
tecnologías de
access to
salud
health
son un pilar
technologies is
fundamental a la
constitute a
salud
fundamental
universal
pillar for
y que
reach
por
universal
eso
health.
son de verdad
And
una
that's why
estrategia de salud
that
pública que
is
tiene que
part
ser
of the
reforzada,
public health strategy
mejorada y
that need to be
fortalecida siempre
reinforced
de
and
manera
strengthened,
continua
improved,
en los
always in a
diferentes
continuous
países de la
basis in
región.
different countries
Esa
across the
mejora,
region.
ella tiene
Now,
que
this
ser hecha de
improvement
manera sostenible,
needs to be carried out
tanto
in a sustainable
cuando estamos
basis,
hablando de acceso a
both
los
when we are
medicamentos,
talking to
incluyendo
about
ahí
access
los
to
medicamentos y
medications,
las
including, of
tecnologías de
course,
alto precio y
medications
de
and
alto
high
costo,
cost
así
technologies,
como la
as
innovación y la
well as
fabricación.
innovation in fabrication and
Evidentemente,
manufacture of these medications,
desde hace
medicines.
algunos años,
For some
PES tiene
years now,
trabajado
PAHO
en
has
tema de
been
acceso a
working on
medicamentos.
access
Incluso
to
tuvimos una
medicines, and
resolución
we even have a
dedicada a ese
resolution
tema.
that treated
Am,
that
y lo más importante es
topic. And what
percibir
is
que en el
most
curso
important is to
de
perceive
los
that in
diferentes
the course
diálogos con
of
los
different
países,
dialogues with different
seguimos y
state
los
members,
países siguen
we continue
reforzando los
emphasizing, the
desafíos
countries
que tienen
continue addressing the different
en la
challenges they
incorporación
have
de
when it comes
tecnologías,
to
en
the
el uso de
incorporation of health
genéricos y de
technology, the
biosimilares y
use of
la
generic
necesidad
medicines
de
and
perfeccionamiento,
biomedicines,
de
and the
mejora y de
perfectioning or improvement
expansión de estas
of these
políticas públicas.
concepts and
Uno de los
expansion and
puntos que
inclusion of
vemos
these in the
como
public
un
policies. One of the
desafío para
points
los
that we
países de
see
la
that
región
has
es al
become a
acceso
challenge for different
limitado a la
countries in the region is the
información
limited access
en
to
diferentes
information
marcos,
and
¿no? La
different
ausencia de transparencia de
frameworks, the
precios,
absence of
la
price
ausencia de
transparency, the absence
informaciones
of
acerca de otros
information
países para
about
analizar
other
este panorama
countries so that we
persistente,
can
pero
carry out
también
a comparative
acceso
analysis,
limitado a
but also
algunas
limited
informaciones
access to
relevantes
some
como
information that
las
are quite
informaciones
relevant, such as
relacionadas a las patentes y
information
sus
in respect
impactos
to
en salud
patent and
pública
intellectual property
y
and
la
the impact in public
disponibilidad
health and the
de esos
availability
productos en
of
los diferentes
those products
mercados.
in different
Acá
markets
lo que
across the
tenemos
region.
son
Now, what we have
elementos que no
here
solo
are
percibimos
elements
que los
that
países
only
lo
we
necesitan,
perceive
como
that country
también
needs
son
them, but
desafíos
also
y la OPS está
we
dispuesta
recognize that
a
there
apoyarles
is that
para dar
PAHO are
seguimiento al
willing
trabajo.
to support you
Evidentemente
so
que
that
el
we
tema
can
de
have a
disponibilidad y
continuous
garantía
work.
de calidad son
Availability
ejes
and
fundamentales en el
guarantee and
trabajo
quality
de
are
cooperación.
fundamental when it
¿Y
comes
qué
to
vemos
have
acá?
a cooperation.
Como
What we
los
see here,
principales
how
problemas que remarcaron
what
los
are the
países
main
el
problems that
alto
I
costo
was talking
sanitario
before?
con productos
The high
farmacéuticos no es
cost and
novedad,
expenditure in
la
health
poca
and pharmaceutical
utilización de los
products, that's not
genéricos
a
y
new thing.
biosimilares,
The
el
bio
tema de las
generic
brechas
drugs and
en
bio
salud es
medicines,
bastante
the
amplia,
gaps in
pero
health are pretty
lo que tenemos son
broad.
brechas que
What we have
vemos,
now
inequidades que
are
vemos hacia dentro
inequalities
de
that
los
we have
países, sea
seen
por
inside
ejemplo
the countries,
en
let's say,
relación a zonas
in
urbanas y
respect
rurales, pero
to
también
urban
entre los
zones and
diferentes
rural
países
zones,
de
and
la
even between
región,
different
unos
countries of the
accediendo a
region.
determinadas
Some
tecnologías que
are
otros no
having access
tienen
to
igual
certain technologies that
disponibilidad,
the others
la falta
cannot.
de acceso a datos
And
e
the lack of
informaciones, como
access to
hablamos,
data
y
and
eso
information, as
mejora
we
la
said
toma de
before,
decisiones.
that is essential to
Am,
have a good
la alta
decision
dependencia de la
making
región a
process. Now,
productos
high dependency
importados.
of the region to imported
Tenemos acá
medications.
algunas
We have
concentraciones de mercado
some
para
concentrations
algunos.
in
Esta
markets
semana
that
estamos realizando
this
también acá
week
en la
we are carrying
OPS,
out here,
no,
by the
no
way,
desde
in
nuestro
Pajo, not from our own department, but with the support of our colleagues. We'll be talking about diabetes, and one of the concentrated markets, and insulin is one of them. So those concentrations and those analysis, how markets are performing, how are they performing in our countries, are fundamental to move forward. General frameworks and public policies of different countries that oftentimes are not the right ones to improve access. And especially when we are talking a high cost medication, but likewise when we are talking about generic and biosimilar ones. Now, the issue that notwithstanding there's been an improvement, we have um, institutionalized the health technologies in many countries. I think little has been achieved in linking to them assessment among others. I am bringing here an outlook, a general outlook, so you can have an idea we were talking about. I believe that what is most important here is be to listen to the other panelists who will be telling us about their experiences, good practice, and assessments. But it's also important to contextualize and saying that 60% of the health expenditure in Latin America and the Caribbean are oriented to pharmaceutical products. Now, when we're talking about biosimilar, and maybe you can have your idea of the difference in prices that exists in countries in respect to the use of the reference medication or biosimilars. When we talk about generic, for instance, they represent around 35% of the total market. For instance, in one South American country, biosimilars is about 8%. And this not any country, it's one that has conditions, good conditions for incorporation. Can you imagine those that had less incentives though for biostimulants so that they can carry out the sanitary registration? One fundamental point in expenditure, and I believe that we see increase in expenditure in the region is quite expressive, going from 48 to 74%. And an increase in utilization, I think it's important and impacting in the region. When an increase that goes from 30% in Brazil, 119% in Colombia, 144% in Costa Rica. And when we think that that is pretty punctual, let's say it's not the case. It went up 5 times in Argentina, for example, Uruguay, and more in other countries, we see that process of increasing utilization. So it's a fundamental point, I believe, because oftentimes those medications and those technologies are not cost effective, and it is discussion we want to generate.
So going back to the generics, the low participation of generics in the market, and these are unbranded drugs. So you are able to say that my country has a lot more generic drugs, but um, at the same time, the policy to increase the amount of patents for some of the products that are in the region and the way that these protections are going to impact the national markets, not allowing the entry of generic drugs, and sometimes with very big differences in the assessments between the different countries of the region. And for the issue of generics and biosimilars, we continue to see this is an access, a fundamental access point. Pricing has a direct impact. So there you can see, have an idea based on a drug. Like for example, in blue, you can see the biosimilars and the generic drugs. And in red or orange, you can see the reference drug and with a price variability that's very big. And beyond the price difference, sometimes the lack of availability of this biosimilar drug or generic drug in the market. And you can also see that in terms of pricing and also the volumes and the values. But it's not only the specific case that we're talking about for expenses from out of your pocket. We also have the national context, regional contexts, and also contexts that are global. And this is a global context, and Miguel, I'm close to finish, of the different voluntary licenses. All of these countries that you see here, for example, for drug for HIV, they had clinical trials and they were part of the these clinical trials, and the ones that you see in red are the ones that are part of the voluntary license process. And unfortunately, the ones that are in blue, all of the countries of the region, in this case, do not have those voluntary licenses, and this have a direct impact in the pricing. What you're seeing there are the different components that could be the criterions used to define if either you can use those voluntary licenses or not, if they want to be part of those. This is one of the new cases, mortality, and what we see here is that when we compare some cases like Peru and Thailand, what you can assess based on those criterions is that both countries would deserve to be in with a voluntary license. And the same way, we see some concentrations in the market. This is the example of the insulin market, as I mentioned before. This week, we are going to have a meeting regarding diabetes. So it's very timely to talk about insulin, where we see that in the region, in some countries of the region, there are 3 large companies that have more than 95% of the market share. And when we assess other countries from other regions, we see that there's a bigger share of different suppliers or distributors. And we don't want to talk only about problems. We want to offer solutions and to have cooperation and support with the different countries. And that's why we are proposing the development of integral access, promotion of competition, the development of strategies and legal frameworks based on evidence and strengthening transparency, a joint procurement, and PAHO has the availability even of having regional funds and rotary funds to support procurement processes, consolidated procurement processes to improve transparency and the generation of information and to foster innovation. And to do that, in the access area, we are working to join and strengthen their national capacities in the region and also to give more visibility to their good practices. So we are working with the strengthened access for access and the formulation, implementation, and evaluation of the different policies to improve equity, optimize transparency, and to have a better response to the needs of public health, and to promote the competition, which is one of the key elements. It's also important to mention that these are the axles of actions that we have in place, but it's important also to mention that we are in the process to build by the request of the member states to work on the resolution of access to high-priced drugs that are going to be that's going to be approved by the countries and discussed next year. And we want to invite everyone to contribute and to participate here so that this is a resolution that not only brings or talks about the problematic of access of drugs and technologies for health that are very costly, but also that it can give proposals to highlight some possibilities and solutions for the countries of the region. Having said this, thank you very much. Thank you very much to everyone. Thank you, Juliana. We're able to see the capacities that our department to support the member states have in terms of technical cooperation. I have some announcements that I forgot. This session is being recorded. It's going to be available with the original audio and the 3 languages in English, Spanish, and Portuguese. And it's going to be available in the YouTube channel, PAHO TV. And in PAHO, we embrace cultural diversity in the region of the Americas, and that's why we offer the presentations to have the 3 original languages, and that's why we have an excellent interpretation service. And finally, and not least important, we would like to thank all of the colleagues Alejandra, Juliana, Catalina, Ana, Liseli, Orlando, and all the administrative team, Catalina Cárdenas for communication, and also our colleagues from the network of sanitary network that supported in some discussions. Marianne and I, we have approximately 360 people connected in this moment. Having said this,
to introduce and welcome to the Boston University presentation. Welcome, Veronica and Warren. Let me introduce both of you. Dr. Veronica J. Ruiz is a professor of global health at the Boston University School of Public Health, where she is also the director of the World Health Organization Collaborative Center in Pharmaceutical Policy. Dr. Ruiz's research focuses on health system strengthening and program and policy evaluation of medicine access and utilization in low and middle income countries. Between 2014 and 2016, she was the co-chair of the Lancet Commission on Essential Medicine Policy, which publishes its report Essential Medicines for Universal Health Coverage in 2016. She is a visiting professor of the National Institute of Public Health in Mexico, where she was a faculty member between 2005 and 2012. Dr. Ruiz received her training as a pharmacist for Albert Ludwig University in Freiburg, Germany, and her Master of Science degree in clinical pharmacy and her doctorate degree in pharmaceutical policy from the University of London in the United Kingdom. On the other hand, Warren Kaplan is a clinical assistant professor in the Department of Global Health at the Boston University School of Public Health, where he is a member of the World Health Organization Collaborative Center in Pharmaceutical Policy and the VU Global Development Policy Center. His research focused on pharmaceutical and legal policies related to health system strengthening and evaluation of medicines, access, and utilizations. His current interests and expertise includes intellectual property, antimicrobial resistance, medicines price analysis, generic medicines policies, quality use of medicines, and access to medicines for non-communicable diseases. He has worked as a technical advisor for various international organizations, among them Doctors Without Borders, Clinton Foundation, the Alliance for Health Systems and Policy, Health Action International. It's a pleasure to be in both of you, Veronica and Warren, with this presentation to see the overview in pricing policies in the American region. So the floor is yours.
Thank you, Miguel. I'll start out on behalf of Boston University. It's our pleasure to be here and present on the subject. I'm going to turn my video off to minimize distractions. I also apologize for my lack of Spanish. Sometimes I barely even speak English, but let's start. If I can get the next slide, and I'll turn it over to Professor Wirtz after the first half of this presentation. This sets the context a little bit. The pharmaceutical sector is one of the largest sources of health expenditure in Latin American countries, as we've heard. So what we're plotting here on the x-axis as of 2019 is the percent of pharmaceutical expenditure as a function of total health expenditure in various countries, including the US. Each country has its own unique economic, political, and social history. But medicines are indeed, I would say, a financial burden for both governments and people, and this burden impedes access. There are several areas of policy concern which people know about. As you know, the development of generic markets is clearly an opportunity to increase efficiency in pharmaceutical spending, but many countries are not fully exploiting this potential. Generics obviously I shouldn't say, they're often less expensive than the brand names, but the underutilization of generics is clearly a substantial source of, I would say, financial inefficiency. Next slide, please. Yeah. In this context, so this information is from the OECD primarily and summarizes some of the reasons why the healthcare and pharmaceutical, I would say, ecosystems are inefficient. The middle blue column, you could see those three columns summarizes three circumstances that we can define as, quote, wasteful. Patients don't receive the right care. Benefits could be obtained with fewer resources. Resources are unnecessarily taken away from patient care. And the red boxes on the right illustrates some, but not all, of the consequences of such inefficiencies related to the use of medicines. I'll read them. Avoidable adverse events, low value care, ineffective or inappropriate care. The middle box, overpriced medicines or input, generic versus brand medicines, and then high cost inputs are used unnecessarily. This is part of the inefficiencies in healthcare systems, generally physicians instead of nurses, inpatients instead of outpatient care, and so on. Okay, next slide, please. So our PAHO colleagues suggested that we present on the following three aspects. And we'll emphasize the issues in the particular language in bold lettering. One, contrast the access policies to manage prices globally and how their differences can be explained. Two, deepen into some of the most preferred options and the evidence of their impact and considerations to be implemented. And number three, reflect on where there are still opportunities to advance in access policies on pricing for the Americas and its implications. Okay, next slide. This is a very high-level comparison between particular countries in Europe, OECD countries, and those in the Americas with regard to policies related to pricing. There are a few things that are relevant. Number one, European countries have the richest experience in pricing policies compared to many other regions, including Latin America, as we know. Only a few countries in Latin America and the Caribbean have very comprehensive pharmaceutical pricing policies. Brazil and Colombia are among the most advanced, I would say, in this regard. Further, different countries use different combinations of these policies: internal reference pricing, external reference pricing, value-based pricing, various procurement regulations. So note that the parentheses around value-based pricing notes that this policy is just emerging, and we can talk about that a little bit later. It's very important, as you know, to emphasize that external reference pricing and value-based pricing are primarily related to the pricing of patented products and not primarily for generics. And the differences among these countries are due to many factors. Let me just say, it's likely to be due to the fragmentation of their healthcare systems. And by fragmentation, believe me, the United States is not immune to fragmentation, but fragmentation means sort of division of the healthcare system without explicit means of coordinating different functions or coordinating the various stakeholders, payers and providers. And this leads to poor communication and coordination among governance systems. Again, the U.S. is by no means free from fragmentation. In this slide, we're looking at a very high level, the differences between countries with regards to regulation, reimbursement, and budgets. Just quickly, within regulatory systems, in the OECD, it's clear that all generics and biosimilars require proof of bioequivalence. But it's not obviously the case in the Americas, as there's certainly variation, I guess that's the word, in how generics are regulated. And this fragmentation, I would say, leads to different equivalences of medicines and differences in terminology, in our opinion, similars, copies, generic medicines that do have proof of bioequivalence. So there seems to be important differences in regulation related to generics, especially around bioequivalence, as we know. With regard to reimbursement, in the OECD, there are no reimbursement distinctions between INN generics and branded generics, as the public payers in these countries cover most of the expenses and thus, I guess, have the responsibility to secure the overall sustainability of healthcare. A few countries, and I don't know the reason to be honest, Belgium and the Netherlands regulate the prices of all medicines, even those that are fully paid by the patients, to avoid financial burden in many households. In many Latin American countries, on the other hand, a large segment of the population obtains medicines directly from the private sector, where they have to pay out of pocket. This is, we know, and differences in the price of branded versus unbranded generics affect directly the household budgets. With regard to budgets, you can see the differences listed in the table, at least. As you know, many countries in Latin America have parallel healthcare systems in which mandatory health insurance or social security systems are different for workers and subsidized public programs and private mechanisms. So we note that Brazil has a predominantly single payer system and common benefits for the population, although many individuals also have private insurance. So this is this fragmentation business I was talking about before. Okay, next slide. So this slide, this summarizes clearly the challenges faced in the Americas with regard to governments directly managing the price of medicines using external reference pricing and the issues with value-based pricing and health technology assessment. Basically, with regard to external reference pricing, it's used in most European countries except Sweden and the United Kingdom, and is used typically, as I mentioned, for patented medicines. External reference pricing is frequently supplemented by health technology assessment to determine the added therapeutic benefits and inform the pricing decisions. With regard to the lower part of this picture, which talks about value-based pricing, although Brazil and Uruguay have central health technology assessment institutions that issue recommendations for the entire country. Some countries have implemented agencies that make recommendations that apply only to specific populations. Some have no formal HTA mechanism, or some are just beginning to establish them in some Central American countries. The use of health technology assessment is, in our opinion, a good example of this fragmentation of healthcare. One problem in having parallel systems, I guess, is the possible existence of different cost effectiveness benchmarks or cost effectiveness thresholds across the various sectors, owing to differences in budgets and public and private social security systems. So there's lots of challenges with the capacity and the financial resources of countries carrying out health technology assessment. And you can see some of the information here about price information is lacking, and it's very resource intensive. So you see some of those. Of course, they're in English, but the medicines may be cost effective following a health technology assessment, but still not be affordable. So next slide, please. This is just some examples, some country examples of direct pricing policies. Our presentation is clearly not a comprehensive literature review, but we would hope that representatives of some of these other countries will provide their interventions. Mexico has maximum sales prices for patented medicines. El Salvador has maximum retail prices of prescription medicines using external reference pricing. And you see Ecuador has several different pricing regimes. Brazil has a maximum price set for the public insurance system, and so on. So again, we hope that representatives can illuminate us further on some of these policies. Next slide. So this is books have been written about promoting generic
Sobre la
medicine.
promoción.
Hello, am I out of time? There's some well-known policy solutions. A distinctive feature of Latin American reality is the low effective coverage of medicines in health plans. That's reflected in the high out-of-pocket payments. This means that users, patients, depend on the pharmacy outlet, what kinds of products to recommend, and what the user prefers. Many patients go directly to the pharmacy without consulting a doctor to obtain medicines. Others who receive a prescription may not receive a prescription with the INN name. So the pharmacy may not offer a genuine generic substitution. And that has a direct impact on price and hence the household budget. And I will turn this over to Professor Wirtz now. Thank you very much.
Thank you so much, Warren. This is great, and it's a pleasure to be here. I will present now on the second part of this presentation and illuminate some of the aspects that Warren has already mentioned, and the Pan-American colleagues, including Miguel, asked us to present some evidence of the impact of those policies in Latin America. And one important key indicator that is often used to describe the impact of generic medicine policies is the penetration of those products in the market. So what you can see here in the slide is an overview of the percentage volume of generic medicines represented out of the total pharmaceutical market. And this figure shows that on average in those Latin American countries here depicted, they have a larger proportion of generic medicines in their market in terms of volume compared to the OECD average. However, it is important to take note of that the majority of these generics are branded generics. Warren already talked a little bit about the implications of that for the consumer. In the next slide, you see another important comparison. I can go to the next slide, in which you see the value, the percentage value of generic medicines as a percentage of the total pharmaceutical market in 7 Latin American countries plus the OECD countries as a comparison. Here again, the graph shows that the generic drugs in terms of their value in the pharmaceutical market is generally higher than in the OECD countries. And generally, that is interpreted to be positive. However, again, we need to take into consideration that this does not necessarily mean that those generic medicines are affordable to individual consumers. Now I would like to switch to a next topic that also Miguel and his team asked us to take into consideration in our presentation in this overview of policies, which are biogeneric medicines and biosimilars, and the biosimilar market and the policies to promote biosimilar products. As most of the audience know, biosimilar medicines and reference medicines are made from living organisms like bacteria, yeast, or animal cells. And even though biosimilar medicines may be made in different ways and of slightly different substances, they are expected to have the same safety and effectiveness as the reference drugs. So generally speaking, biosimilar medicines are less expensive than their reference drugs, although the difference is not as large as generics versus originator medicines. When it comes to the evidence about the utilization of biosimilar medicines in Latin America in the Americas in general, this graph provides some important evidence. It shows you the per capita expenditure for biosimilar medicines, and here you can see that Brazil ranks first with about $50 per capita expenditure, followed by Mexico with about 20, and then followed by Ecuador and Chile. The results in spending per capita in biosimilars are very similar to the findings regarding the countries with the most approved biosimilar medicines. Brazil is the country in the region that leads, followed by Mexico, Argentina, and Chile. Although the per capita expenditure is not the only indicator that we should use, there are also others, as I just said, the number of products on the market, or in this case, also the number of manufacturers in each country. And here, Argentina stands out as a leader with over 350 manufacturing sites with the capacity to produce biosimilars. The establishment was promoted by a number of stakeholders, including university, scientific technology, the scientific technology community, and the state. On the next slide, I would like to speak a little bit more about barriers and challenges to incorporate biosimilars in the region. There are many, as you can see on the slide, and I would just like to highlight 3 for time reasons. There is a regulatory framework, the inconsistency in terms of regulation, and I think that was alluded a little bit already by Juliana. That plays an important role. For instance, a lack of specific and harmonized regulation for the registration of biosimilars in some countries, and it's important to establish clear and consistent standards. Then we have a different type of investment and R&D in biosimilars. Juliana said that many countries in the region at the moment are investing in local production. At the moment, this is different, as we have seen from the evidence. There's large variation in Latin American countries, but there's certainly grounds for increased investment in local production and the capacity of innovation in this area. Then also in terms of training and expertise, it's really important, not only the training and expertise in terms of regulatory aspects, but also in terms of the use of those medicines. For instance, there's evidence from the European Union and European countries that is extremely important to train healthcare providers in the switching of patients from biologic medicines to biosimilars. And this needs to go hand in hand with the creation of guidelines for such switch, as well as creating patient demand and patient trust in those products. Then Miguel and his team invited us to briefly reflect on the remaining opportunities, which I will briefly do. In terms of the early entry of biosimilars, we know that this is really important in order to increase the number of biosimilar products in the market. There are a few things to mention here, and I want to point out also some positive examples, or let's say best practices. For instance, in terms of establishing a common regulatory framework, that can an important point, as well as increasing transparency. For instance, Brazil and Cuba currently are publishing a complete summary of product characteristics for each authorized biotherapeutic and reference for biosimilar. And this is important also to increase trust in the process. Then we have the maximizing the adoption of biosimilars, and I think there are other important areas to promote the use of biosimilar medicines in terms of, for instance, the promotion of domestic production, as I said, but as well the training for healthcare providers in terms of biosimilar medicines and enhancing the capacity of regulatory agencies. Here again, it is important to point out the example of Brazil that has for decades invested in domestic local production. Here to point out, for instance, the partnerships for productive development, PDPs, for instance. In terms of early entry of generics through administrative and legislative procedures, here we highlighted already the importance of the harmonization and the adoption of international requirements for bioequivalence. Warren's fleshed this out more in terms of what the consequences are currently in not having a harmonized approach to it. And so encouraging an early submission of regulatory applications is important in addition to that. And here we have countries with examples in the blue box. You can see there's examples in which countries have actually implemented strategies to enable an early market entry. For instance, by granting tax exemptions, or Ecuador with simplifying bureaucratic procedures. Then as well on the generic medicine side, the maximization of adoption. And here stand out, as mentioned by some other speakers already, the importance of prescribing by INN, which means that there should be incentives given for prescribers to do so. There is already in many countries a legislative requirement, but it's not necessarily enforced. And here countries have tried to think creatively of providing incentives, such as, for instance, instituting electronic prescribing, which requires the prescriber to use the INN. As well as Warren mentioned, the importance of generic substitution, and that needs to be initiated by the dispenser instead of letting the patient initiate that request, which is the case in some countries, but there obviously the lack necessarily, or perhaps the lack of knowledge with users in terms of requesting a substitution. So initiating that by the dispenser is very important, by the pharmacy staff in that case. And then also increasing the trust with professionals and consumers in the quality and safety of generics. Juliana pointed there to very important evidence that shows there's a lot of work still need to be done in that part. So in conclusion, I would like to offer some conclusion. This presentation obviously is too short to provide a comprehensive discussion on all the access policies. We will hear from Brazil and from Chile interesting examples. We have only alluded to some. We have focused very much on policies that increase competition in the medicine market via promoting generic medicines or biosimilar medicines. There are other policies we could discuss if the audience like. We have shown in general policies to promote generics as well as biosimilar medicines remain underutilized in the region, so there's a lot of work that can be done. Many countries work already towards it. Juliana made the case for that. And in our presentation, we spoke about the importance of the regulatory side and the harmonization in both cases, generic and biosimilars. And then finally mentioning throughout the presentation, building trust by users and healthcare providers is extremely important, particularly in the Americas, because often consumers, users make the first choice here by having direct access to medicines. Thank you very much.
Thank you, Veronica and Warren. Fantastic presentation. We talked after the Fair Pricing Forum early this year and thought that to perform this webinar because the Americas region needs are different due to diversity, to the health systems, different settings. So Veronica and Warren just show us the overview and key message to how to address the different situations in local context. Vamos a mudar para português.
Well, now we are going to switch into Portuguese. I would like to introduce with you with the first experience as a country, Daniela Marrero Sequeira. He is Executive Secretary of the Medicine Chamber, CEMED. He takes a position of a specialist in health issues since 2006. And also in general management of medication, general, and advisor in the update of sanitary registration of biologic products. Also acted as attached director and now occupying other positions of advisory positions and management positions. Doctor in molecular biology from Brasilia University, UNM, and has a licensing degree in sanitary surveillance. Welcome, the floor is yours. Many thanks, Miguel. I will be sharing my screen with you. Please tell me when you see that.
No, okay, it's okay.
Estão vendo?
Yes, great.
Muito obrigada, agradeço pelo convite, agradeço pela
Well,
organização.
many thanks for the invitation. I thank the PAHO for this opportunity to share such important experience in respect to this a topic of health that is quite relevant for all countries concerned. I'm going to show and introduce the Brazil experience and the function of therapeutic value. Very important in that process is to share everything that has an influence on the access to medicines, to medication, and that could, let's say, impede the access to several countries. Of course, it could lead to a shortage of certain medications in the country. There are individual factors like lack of information and education in health. It's important to take this into consideration, as well as prices. I will be focusing on prices along my presentation. In Brazil, we have a public health, universal public health system, our single health system, the SUS, which already gathers about 70% of the population. And complementing that public system, we have the supplementary health system that is actually comprised private health insurance policies that covering almost 30% of the population. This is according to information coming from 2019. Brazil worldwide is one of the countries that has the largest direct expenditure in health, expenditure out of pocket, with representing a big portion, chunk of family budget that disbursed directly by families. more specific in respect to the regulation, price regulation. I'm going to show how Brazil regulate the prices for medications. It's just to say that there are different aspects that has an influence in the regulation of prices in different countries. And Brazil is not the exception. At the same time, we need to consider important industrial aspects in this and the degree of development of the country. This, of course, have influence and number of suppliers, whether public or private. And we also need that balance is really well balanced, so to speak. And medicines that these suppliers need to supply so the population have an access. We have confronted products that have products in different prices, but they need to be affordable by many portions. That is a challenge that really puts the balance out of place. Some of the orientations coming from WHO, the policy countries should consider for introduce them in the policies for pharmaceutical products. Brazil uses or resort to different aspects in this. I will be showing them more in detail because we use the standard reference, the classification based on value with assessments for technology among them, and that is what we use in Brazil. So we need to move forward also in other aspects, for instance, regulation on the profitability or margin, the public tenders or bids and private tenders and bids is something we still need to work out. But Brazil is quite transparent and to define prices for the medicines. CEMED, which is the regulation chamber for medicine, they're really in charge of this process in Brazil. And biosimilars, the same as we have heard before, that is something that we consider very much in our price policy. Also, prices based on costs that are not really part of an updated module. So the regulation chamber for prices, we define the prices for different products in the country. We use the standard reference to start with, prices that are considered and they are incorporated into the resolutions provided by CEMED in 2004, for instance. Those countries that we consider reference: Australia, Canada, US, France, Spain, Greece, Italy, New Zealand, Portugal, and of course the country of origin of the product. These countries have established product, or Brazil has established the product, the price for those products according to those that information. And for standard reference of price, we'll be using a treatment for other medications that are available in the national market for the same pathology, and to ensure that they are used to define put the final price for biosimilars. We have something established, 35% in respect to the reference price. In the case of new products and biological ones, you utilize the external reference considering the same countries that I mentioned before.
Look at the prices where we're going to have a calculation with the treatment with products that we still have available on the market.
São aqueles produtos novos, novas moléculas no país e que apresentem algum tipo de ganho ao tratamento. O que a gente considera como
This presents some time of earnings to the treatment that we consider are wins for the treatment to have efficacy or the reduction in the global cost of the treatment. And these are the wins that our resolution takes into consideration right now. And apart from this, for the product to have the price, so that it was a category 1 price, it has to have patents. For the molecule in Brazil, we have the criteria of the patent of the molecule in Brazil, and the theoretical wins, so that we can use external references price to define it so that for the drug. And it's important to highlight our difficulty, as we mentioned before, the difficulty of obtaining prices for the drugs in other countries. Regarding the therapeutical wins, we consider efficacy, security, or significant reduction of the global cost of the treatment in order to classify the product as a product that has a therapeutical win. And for the new drugs, the ones that are not classified in category 1, or the ones that do not have a patent of the molecule or do not have any proved earnings, we classify them in category 2, and these are two different prices here. We consider the cost of the treatment or the international price, whatever is lower between them. In order to have the cost of the treatment, we have to find a comparison, taking into consideration scientific evidence and theoretical alternatives that are taken into consideration for the same treatment, for the same line of the treatment, populations, and those products that are that have a registration in Brazil. These products can be chosen as drugs to benchmark the cost of the treatment. Regarding the biological products that are not new or biosimilars, it's important to highlight that Anvisa has a rules from 2010, the resolution 55 in 2010, that talks about the criteria for registration of biosimilar drugs in Brazil. Regarding the classification, the prices of the products that are biosimilars are defined based on the criterions that are published in 2016. Basically, these are the same criteria that I have mentioned before. For setting the price of the biosimilars, we use internal and external references. But it's important that in this case, as we do in general, these are products that do not present theoretical winnings or surplus. These are based on new drugs and the portfolio of the company, where we are going to use the ceiling of the cost of the treatment or international pricing. We consider the same countries that I mentioned before. And in the case of a drug that already exists in the portfolio of the company, we have the average of the cost of the treatment with the commercialized products by the same company. And these are the criteria that we use in order to classify the biosimilar products in Brazil. Based on the scenario, based on biosimilars in the country, we have 55 biosimilar products that are registered in FISA. And seeing the data of commercialization of 2023, we have seen that 33 out of the 55 products that were commercialized in Brazil in 2023, we have less than 60% of the products that are biosimilars that are being commercialized. Regarding the market, we have also observed that it's still very discrete. The participation of biosimilars is discrete. Take consideration the category of biosimilars. Biosimilars respond to 17%. They correspond to 70% in terms of the quality. And if we consider the total of the market in Brazil, all of the biosimilar drugs respond of 0.27 and 2.38 in terms of billing. We have important challenges when we talk about biosimilar drugs. In Brazil, we have different legal decisions that define the biosimilar drugs with the same price of the reference drug, which interferes with the access of the product and the payment model that is used in the market, the paid market, health plans, and this problem can create inconsistencies in the biosimilar market in Brazil. The classification rules that are defined in 2016 that has to be revised for having a classification policy that can be a little bit more aligned by offering access to these products, and the definition of exchange, taking into consideration the advances that we've had in other countries regarding this topic, and the promotion of the national development of those products. That would be one of the policies, industrial policies of our government, so that we can foster the manufacturing of this process in our country. It's important to highlight also that with the advances that we have been able to observe in the pharmaceutical market, many cases are not possible to be classified according to the criterion in resolution number 2, because this is a resolution of 2024 that did not take into consideration the different aspects that are present today in the market, like products for advanced therapies. And in this situation, other criterion are used or can be used apart from the external reference and internal reference, as for example, studies of availability for payments, studies for economic assessment, and these cases are classified as not taken into account because they're not in the criterion that we have in a resolution. And these products that are classified as cases that not have been taken into consideration as advanced everything, they have the definition of a price so that they can accompany the update of the price of this drug in other countries of the basket, and to accompany the efficacy security data that are obtained throughout time after the registration of the products. And what are our challenges in order to set the prices and products with advanced therapies? Why they take consideration not being considered? This is because of technical issues that are related to this type of drugs that have to be taken into consideration in the moment of classifying. We have things like durability effects, clinical studies that have not been finalized yet. There's no data about efficacy, long-term security, and individualized therapy, even logistics, distribution, transportation, administration of these products, and the use of substitute drugs. There are different aspects that have been classified with the products that we have assessed. There are 8 different advanced therapy products that we are showing here. These are products that were already assessed by CIMMED, and the different technical aspects that we have mentioned before. These are have not been foreseen in our resolution for the classification that impacts the definition of prices of these products. This way, all of them were classified as cases that were not taken into account and had the definition of price that's not permanent, so that we can accompany the evolution of the prices and the reference country prices, and also the efficacy and security data that were obtained. And to finish, it's important to highlight the fact that CIMMED is going to update the framework of norms for Brazil, and these things can help us to revise our price policy with Resolution 2 of 2024 that talks about the criteria for classification of drugs in the country, and also the definition of criteria that are specific for the classification of biosimilar products for the products that are innovative and products that have been subject of an innovation, incremental innovation, the classification of advanced therapies, and the internal rules from CIMMED. All of these are topics that are being included in the strategic planning that we have. Thank you very much, and I'm here open to questions. Thank you very much, Daniela. Now I'm going to shift to Spanish. Now, in the end, we should be able to answer some of those questions if you have any. Now, let's continue with this journey. Now, let's go to Chile. I would like to invite Héctor Hernández. And as you saw in this event, what we want to do is to see how we can promote access through managing prices from different perspectives. We just saw one where Brazil, in a very methodical way and a detailed technical way, supported the evaluation of technologies, and they are actually able to do the definition of prices to improve and promote access. Now we are going to have an experience from Cenabas in Chile with Héctor Hernández Acuña, who's the Chief of Business Intelligence in Cenabas. He's a civil engineer, industrial engineer, has a diploma in health from the Santiago de Chile University. Héctor is leading a specialized team in business intelligence that has been dedicated to transform the data into information, and that information is of high value for decision making and contributes finally so that the offer of health services in Chile can be a lot better. Héctor, you have the floor now. The floor is yours.
Perfecto. Bueno, buenas tardes a todos y a todos.
Good afternoon to everyone. I would like to thank the organization for giving us this space to collaborate, and this allows us to contribute and to strengthen the health of the people.
La Central de Abastecimiento del Sistema Nacional de Servicios de Salud es
The
más conocida como
Cenabast
Cenabast. Nosotros nos posicionamos como un pilar
is
clave de
positioned
la
as a key pillar in the health network, since we are committed with the well-being of the population,
garantizamos la disponibilidad de
and we guarantee the
recursos
availability of strategic resources through an efficient and quality management on the supply of drugs, foods, supplies, and other health services. And our objective is to contribute with excellence and dedication to improve the health of the inhabitants or the people that live in Chile.
Cenabast es una
Cenabast is an autonomous institution, just like the public health system called FONASA in Chile, the regulating agency and ISP. However, we all work in coordination with the Ministry of Health under their umbrella. Our users and clients are located throughout the 4,200 kilometers that Chile has. Among them, we can highlight as undersecretaries, the FONASA system, the health services, hospitals, primary attention facilities, public pharmacies, and since 2020, also the private pharmacies. It's important to highlight that in Chile, and all procurement is being done through the mercadopublico.cl platform, and Cenabast is one of the main public buyers, and especially with the drugs, and with this we directly benefit 83% of the population of Chile. And since 2017 and up to 2023, we were able to make our business go threefold. In 2023, we reached a total of procurement of $1,700 million. It's important to highlight that health systems are not obligated to use Cenabast. However, when using Cenabast, the Chilean government was able to avoid an overhead cost or a lower price of $608 billion, which represents a reduction of public expenses in 46% for the health establishments. Regarding our business model, this is based on the consolidation of the requirements of health establishments, which allows us to harness the scale economy to manage all procurement. And after analyzing and selecting the best assessed offers, which isn't the cheapest always, but is the one that has the best offer, and it's adjudicated to the corresponding supplier. The supplier is in charge of distributing the drugs and the medical devices directly to the medical facilities. And the supplier also issues the invoice for the hospital. The hospital receives the invoice and then proceeds to pay directly to the supplier or laboratory. Cenabast charges a fee for this, a commission, and Cenabast does not have any warehouses for the products that Cenabast imports. They analyze or render this service. And where do we manage our procurement? We do everything through a platform called mercadopublico.cl, a webpage. We do all the requirements with 9 months beforehand, before the first delivery. And we also have supply contracts that go from 18 months. And it allows us to have the option to renew with 18 months more. So our procurement goes from 18 to 36 months. In order to tackle these requirements and to do the procurement with 9 months of anticipation, we have a forecast system and we use a Google DCP platform. This model includes key information like the history of direct procurement from the hospital through Mercado Público, our experience in distribution, our purchases, our epidemiology issued from the Ministry of Health, and also the analysis of transactions from private pharmacies. With this, we have a forecast, and this forecast allows us to anticipate our purchases and to obtain the following results I'm going to show you. Our purchases are done based on the type with administrative and technical that has been standardized. So we give priority to the acquisition of therapeutical equivalents with a weight of 25 points on the total of 100 points. For biological products that are in the right side, the price variable becomes more relevant, representing a 94% of this 100 points. And this is translated into this success case for the product adalimumab for 40 milligrams. Thanks to the management of the new sanitary registry that you can see on the site, on the right side, we were able to drastically reduce the cost. We went from paying $253 in 2017 to $41 in 2024. And these savings allow us to broaden the access to vital drugs for a great deal of patients that require this product. Another success case are products that are bioequivalent, like Eltrombopag, 25 milligrams. In 2023, this product was procured at $13. And thanks to the new registrations in 2024, we were able to drop the price to $2.93, which allows us to save $1 million in Chile. And that's why it's important to have an available offer and to generate competition to generate the savings. It's important to highlight that what moves us in Cenabas or drives us in Cenabas is not only to arrive in a specific point. Chile is pretty extensive country, but also to arrive in a timely fashion with a right amount, without forgetting that we have to find the lowest possible price in order to improve our offer of products. There's a key issue that moves us in Cenabas, which is the transparency and innovation. In the Cenabas webpage, cenabas.cl, there's a part that's in red that includes the observatory. In this observatory, we are able to find a board with our procurements, contracts, distribution, savings, coverage, pharmacy information, among others. And I'm showing at least two boards that I think that are important. The first one is this information that's oftenly used by the industry, which are the months of coverage that we have in our contracts. And these are the ones that are highlighted in red. Therefore, the laboratory knows when we are going to generate our procurement processes, and they can be prepared for facing that procurement made by Cenabas. The next information requires a report of historical purchases for every product that we buy. And we can see the commercial name, the brand name, the supplier, the date of purchase, the amount, and the price, which also allows the industry to be prepared for our biddings and for generating competitive prices for facing our requirements. Some final considerations. It's important to leave this as a message. Cenabas is the main buyer of drugs in the public sector, and we benefit 83% of the population in Chile. Our purchases are public, and they promote competition and non-discrimination between suppliers. We buy products with our that are registered in the Institute of Public Health. We have standard bases that were approved by the by the controllers in the country. So all assessments and admissions are previously known by the industry, and our bases last for 3 to 4 years.
Y con esta última lámina termino. Nuestra labor está comprometida con la integridad y la transparencia. Para nosotros estos
Our
dos ejes
job
son claves.
is committed with transparency mainly, and we reaffirm our commitment to continue being a reference point for the health sector to continue reducing expenditure in medications. So this is just the beginning of our work. We have been doing for some time now, centralizing everything, and our next challenge is to implement interoperability with other consumers and customers to get to know stocks and prices. And there is a new way of expanding our portfolio of products, and that will be online. Our platform will be useful for that. So many thanks, and I'm open to receive your questions or comments. Many thanks. I think you're giving us a good outlook of what is being done to improve prices and the impact we are looking for as to promote affordability and good access. Two quite interesting experiences. I invite all panelists to light up your cameras for this last part. We have been taking a little bit more time than expected originally, but of course we are passionate about topics. It's something that happens to all of us. We would like to propose to you two questions. I think you were able to see, we have had a good audience, by the way, and we have received a good number of questions, but I'm going to summarize in two. And for that, I'm going to pose two questions to all of you. What was, and I reiterate to orient you, to guide you, what was the main facilitator and at the same time the same barrier that you confronted? How did you overcome those barriers for the implementation? I think we saw the one thing is to learn about the practices in other regions in special context, but another thing is to bring those good practices to our countries and adapt them to the reality of our own countries. So what was that driver, no, I would say facilitator to overcome the barrier? And if we were to pick up the phone, they were ringing you and pick up the phone, you were asked, how can you orient us and overcoming those barriers? Maybe it will be overwhelming. Where do I start, you may say? What are the experience of PAHO and other regions where I need to collect information to give that advice to that person that's calling me? Of course, PAHO, which is part of the World Organization, the United Nations, is constantly looking at good practice experiences for other countries. But if you were to pick the phone from somebody bringing you, give me a piece of advice. So perhaps quickly we can do a round between you for that questions. And we have other questions, of course, that I told you we have in the chat, but let's start with this question first. Who wants to jump first?
I will quickly start with a few remarks. Thank you so much, everybody, for submitting questions. This is fantastic, and I think maybe Miguel gives us an opportunity to respond to some in writing this after the webinar, and answers can be uploaded maybe on a site. I think the questions and the discussion in the chat shows the great importance of this topic, the rich experience of countries. I think actors and Danielle's presentation made that very, very clear. There's so much rich experience from countries and across country learning opportunity here as well. I just want to answer very briefly Miguel's question here. What would I say? I think for me, the regulatory harmonization still remains an enormous and important point for consolidation. And that goes hand in hand with many of the questions as well as discussion points in the chat. Many of you raised the point of how can we increase consumer confidence. And the evidence of Juliana that she showed actually in the beginning of her presentation, showing that the consumer confidence in many of the generic products is just not as high as we would like to see that. And this goes hand in hand with the prescribers. So harmonization has clearly something to do with that. The requirements of bioequivalence is not There's not necessarily a requirement of bioequivalence for generic medicines in all countries, and I think that's an urgent pending issue in the region that can then facilitate consumer and healthcare confidence in those products. And I think Danielle's presentation made so clear that this has to go hand in hand with other policies to promote the confidence. And Brazil can certainly be there an example of a country that has done a lot of communication and campaigns in terms of creating consumer confidence, including the visualization. Some countries, including in Chile, have done something on packages to make very, very clear these are generics that have bioequivalence approval. So this is something from my side, and I hand it over to some other experts also to chime in. Thank you so much for having me.
Thank you, Veronica. Okay, who's next? Warren, please.
Thanks.
I would just very quickly say, and by the way, I see the questions, but it would take me 3 weeks to translate them into English. I would say increasing the transparency of pricing and the considerations that go into pricing policies. I know this is an issue in the United States, and I'm not entirely sure it's a big issue in some countries in Latin America, but for me, increasing the information transfer among what I would still say the fragmented pieces of the healthcare system is very, very important. So, thank you.
Thank you, Warren. Who's next? Daniela, Hector. Both of you, maybe Daniela, would you want to give your response? Thank you.
Sim, sim. Eu gostaria de comentar em relação aos seus questionamentos, Miguel, que são muito bem-vindos, e também em relação a dois questionamentos brevemente que eu vi no chat e que acho importante esclarecer. Em relação a facilitadores e barreiras, começando pelas barreiras, eu citaria a falta de harmonização.
Yeah, it's important to have that harmonization, as we have heard, to remove or overcome those barriers. Transparency means a lot. For many years, I was involved in part of regulation to issue registration for medication. So transparency, I know it's quite important, and that we believe that those two are lacking in many countries, harmonizations and transparency. We can help countries in those topics through cooperation so they can have transparency and the dissemination of information. Of course, our objective is to give the majority of the population access to medicines. And so we need to work along with the pharmaceutical industry in those countries that are more advanced, that have overcome many of those challenges. As for facilitators, I would say that clear and consistent regulation is paramount. Always is the objective of the countries, that's true, but that is necessary to understand better what manufacturers need to do to develop and import new products, to have clear regulation, to involve all the parties concerned, working alongside with governmental entities, and very much aligned, understanding the great economic impact this has over the population. Research in countries such as Brazil, with those public-private associations, they have a big potential to favor the population, to provide them access to medicine. So I would recommend countries to work on those policies on a clear and transparent manner. That's part of some of the questions I observe in the chat. Comments. Some were defined in 2004, at the time where the pharmaceutical market was pretty different. And we're still, studies for countries that have similar scenarios, such as Brazil. I heard that some of you mentioned the United States, and even though there's no regulation for prices there, I think there is a reference country for many other countries to use to formulate their prices.
temos
If
adotado
we
preços
were not
provisórios
to
para
have
acompanhar a
the
evolução
United
dos
States
preços
in
nos
that
outros
basket, I
países,
think
mas
would
tudo
be a
isso está em
problem
função da
nevertheless, even though there are no
constante da lei
regulations. But
em relação aos
everything is
monitoramentos
evolving, everything's
desses produtos
changing.
que possuem
And
preços provisórios. É
I
por
also
isso que
think
nós
that it's
trabalhamos no
important
aspecto
that
de segurança
countries
eficácia,
monitor
mas com
prices.
certeza também a efetividade, os dados de
And
uso desses produtos no mundo real
doing that,
são dados que
they
serão
need to
considerados
check
pelo
for the
CNED no momento
efficacy of the products, if,
de
how
avaliação
accurate are the
da
prices,
definição do
or
preço
the data
definitivo
that
para
leads
esses
to the formulation
medicamentos.
of prices to, let's say, finally produce a price for the market. Thanks for your appreciation.
Mira, yo creo que el principal eje para
I think that
mantener y
to
seguir
keep
mejorando es tener políticas
continue
claras, leyes claras,
moving is to have clear regulation,
transparencia y
clear laws,
participación, poder publicar
transparency
los
and
precios,
participation
compra,
above all, and all
producir,
procurement
distribución,
processes.
nos permite
That at the end of the
dar
day
tranquilidad al
will
mercado,
allow us to
fortalecer
provide,
la parte institucional
let's say,
y si
tranquility to
eventualmente
the
la gente
market,
requiere más
giving them
política
assurance that
y
everything
sea
is
de
right.
negociación
Mm,
centralizada. La
Also to
compra de
have centralized
medicamentos por un
negotiation,
solo gran
the procurement and
comprador
buying
permite
of
la economía
medicines
escala y
with
permite
one
controlar
supplier
los precios
allows
a escala
for
global.
economies of scale, and
La
that, of course,
lógica de
will
la
impact on
transparencia e innovación que
affordability and
acompaña me
access.
gustaría a mí
Innovation,
fortalecer
it's
el
another
acuerdo con
aspect.
organismos
I also like to
internacionales,
say that we
la
need to
OPS,
strengthen
y
cooperation
he
with
estado en varias
international
de estas
entities.
reuniones
PAHO is one of them. I
y
have
una
been in
buena
many of meetings
práctica nos enseña
with
muchas
PAHO, and
cosas
they
y lo
teach us a
operativo.
lot.
Entonces yo creo que es
So I
importante
think that it
aprovechar
is important to take advantage
esta
of
fortaleza que tiene la OPS
that
y recoger las buenas
strength that
prácticas
PAHO
que nos
has and
pueden
pick
ayudar
up on
a
good
nuestros
practices
procesos.
they have been able to
Respecto
collect
a
from
algunas
other countries.
consultas que aparecieron en
As
el chat,
for
los
some
alcancé a leer muy
other
rápido.
consultations and questions that
Preguntaban
appear in
sobre
the
el
chat,
pronóstico
they were
a
asking
18
about
meses.
the forecast for
Ese es un
18 months
trabajo
ahead. I think
hemos
that
ido
is
mes a mes
work
fortaleciendo.
we've been
Hace
doing month
5
after
años atrás,
month.
cuando iniciamos con
5 years
esto,
ago,
teníamos
when we
un
started with that,
3%
we had about
de error. Y hoy día ya
3%
va cercano al
error
1%.
margin, but now that been
No creo que
uh,
decir con esto
it's
que
about
estamos ni
1%.
perfectos, pero
I am
sí
not saying that
logramos
it's perfect or
abarcar la
perfectly
modalidad Pareto
accurate, but
80-20. Y
we
eso
are
sin duda
applying
alguna
the
que nos permite
Pareto
anticipar,
rule, 80-20,
obtener
that
mayor
allow us
cantidad de
to have
oferta y
um,
mejores precios.
more supply
Y
or
respecto a la pregunta
for
si
more
nosotros compramos
suppliers
productos
actually,
para la
and
ley
we
Sarbanes-Soto o
buy
productos de alto costo,
produce
sí,
according
SENABAS
to high
que tiene la
cost produce,
misión
and
de
the
adquirir
Senabas, who has the mission
este
that
producto.
they have
No alcancé a
acquired
leer
these
unas
products
cuantas
under
preguntas, pero
certain
hicieron revisión
regulations and
ellos
law.
por la
But
vía de
that is only
comunicación
of the
siempre para
questions
poder
that I
seguir cooperando.
was able to read.
Muchas gracias, Héctor. Muchas
Thank
gracias a
you,
nuestros
Hector.
invitados. Ha
Thanks a
sido
lot to our
un
guests. I
espacio
think
súper
it has
productivo para
been a
poder
super productive
discutir. Sabemos que se nos quedan muchas
time.
preguntas
I
súper
know that
interesantes
there are
que se nos
interesting
han
questions that are
generado.
still
Muchas gracias de
there,
verdad por
maybe
haber
unanswered
materializado
so far,
para
but
todos
we will try
ustedes
to answer
este,
them. Many
este tema,
thanks
que como lo
to
decíamos
all
al
of you. This
inicio,
is a
es el
topic that, as
primero
we
de una
said in the
serie
beginning,
de
actually,
eventos,
this
de lo que
webinar is
queremos
the first
llevar
one
y
of a
dar nuestra
series of
comunidad,
events that we want
reactivar
to
lo que es
have
nuestra
to
comunidad realmente necesita.
reactivate the
Por último,
community on this
y
topic.
agradeciéndole
And
realmente
finally,
unos minutos que nos
thanking,
hemos ido de más,
we have
permítame,
taken more
compañera
minutes than
Juliana Bellini,
expected. I would
mi
like to
colega de la
thank
sede regional
Juliana
de la
Bellini,
OPS, para
uh,
algunas
Pajo,
conclusiones o
to
algunas,
draw some
digamos,
conclusions,
reflexiones para que
reflections
cerraríamos nuestro evento.
that will be
Entonces,
useful to close our event today.
en términos
Juliana, we
generales,
saw in
estos
general
panoramas nos
terms that,
permitió poder
uh, on
mirar
one
que la
hand,
región de las Américas tiene
we saw that
particularidades
the
y
regions of America
necesitaríamos
has certain
basar
characteristics and
atención en
special
contexto
needs.
local,
They need to be
particularmente en
analyzed on a
temas de
local
utilización
context,
de
especially when it comes to
biosimilares o nuevos
utilization of generics or
ecosistemas jurídicos de
biosimilars. We see
oportunidad,
that there are
a su
similar
vez también
situations where there's a big
mecanismos
potential.
para
At the
promover la
same time,
transparencia, no
mechanism
solamente
to
la
promote
transparencia
transparency,
desde
not
los
only
productores, sino la
transparency
transparencia
from
dentro
the
de toda la
side of
cadena que
producers,
entiende
but
los nuevos
throughout the
modelos
entire
que
supply
estamos
chain, or
trabajando desde la
value
sede
chain
regional de Estados
that
Unidos.
we are
Y dos
working that of
experiencias. Una,
Pajo and
decir
yes.
que se
And
había
one
terminado
experience
un
from
modelo de negocio
Brazil that is
internamente muy
supported in
desarrollado y
technology,
de
has a
pactos
well-developed environment,
administrativos que
and
funcionaba en
it
Chile,
impacts
donde
the
vimos
access
que
price.
poder
And
de
one
compra
from Chile
centralizada, y como lo dijo
that
Héctor,
talk
si llamaban a
this talk
instituciones
about the
reguladoras seleccionadas
centralized
que Consejo de
procurement, and that
pudiera
question
tener
that
los
you were
comentarios y
to
por supuesto
be
el cierre de
called
todas las
and the
palabras
phone rings and
de
you
cierre
pick
de
up the
Héctor.
phone. What answer will you give to that person.
Ah,
Many
por la
thanks, Miguel. Many
participación,
thanks to all of
especialmente
you for your
aquellos países que están
participation,
ahora
especially
de
to
la
those
acogida.
countries
Muchas gracias
that
por haber estado.
right now are having their
Obrigada
lunch
a todos
times.
que estiveram
So
aí na hora do almoço.
many thanks to all of you who participated.
Punto que nos
Well, one point that we believe is fundamental here is that there are solutions from one of the points that were quite challenging that perhaps could be used and taken as reference. Uh, some practices that some countries in the region have that other countries can learn from. This is especially for the Central American colleagues that are here in the meeting that left in the chat some questions. I remember we heard about transparency, we heard about clear regulatory frameworks, about the importance of guaranteeing high quality medicines, but especially there's a lot to be done in respect to biosimilar and generic medicines. This goes even for those that have a well-developed regulatory framework. Chile, from Hector, we heard about the impact of centralized procurement and how this is positively impacting the budget. Daniela also highlighted that, saying you. So we want to tell you that we will be in the process of consultation for different resolutions the country is going to produce, but focus on high cost, high price in medicines. We welcome all comments to be produced around this. And for those questions that are still in the chat, it's important to say that given the time, we weren't able to answer all of them. Sorry for that. But we are committed that the answers to those questions will arrive to you with the participation, of course, of panelists will contribute to the answer. So on behalf of our unit of Access and behalf of Alexandra Jubin, that unfortunately couldn't be here with us today, our director, we want to thank you all for your participation, and we wish you a good afternoon, and let's continue not only on this dialogue process and characterization of different challenges each one of you is confronted, but also the cooperation with us to reach concrete action. Many thanks, Juliana. And having said this, we conclude our event. An event that was wonderful. We were able to see very quickly many things, but invite us to outline what we need to do. We are the Pan American Health Organization, PAHO, OPS in Spanish, and we are here ready to provide technical cooperation to all state members and throughout the American continent. And with that, to work closely with countries, authorities to improve the access to medications and the health technologies, and also to promote, especially constructive dialogue with different stakeholders around the common objective that gather us today. We expand the access to medications and health technology in the region of America. Many thanks to you all. See you next time.